You can take the protective cap off.
It's a skill paramedics want more British Columbians to learn, how to administer the life-saving drug naloxone when someone is overdosing.
It's staggering to see the elevation in the amount of overdoses that we're seeing still.
And it's record numbers. In one day alone, in March, the BC Ambulance Service received 205 overdose calls. It's now averaging 120 calls a day.
At first it was just fentanyl that was on the street, but now we're seeing the fentanyl and it's mixed with a variety of other substances,
often making it much more toxic.
My son had 7 overdoses in the last year before he finally passed away. He was my partner. He was,
Alex Tablotny says his 36-year-old son Curtis struggled with mental health issues. He self-medicated with illicit drugs, which killed him this past December.
So we're not only dealing with the death, but we're dealing with the guilt of did we do enough? We didn't do enough.
Tablotny says the government is only taking half measures. He wants testing strips for toxic drugs more readily available.
Our loved ones and those who struggle.
Rallies were held across the province today with grieving families sharing their stories. It's a group that just keeps getting bigger every year.
Your child is more likely to die from fentanyl than falling off his bike.
Many here calling for more access to safe drugs now, including Jennifer Howard, whose son died of an overdose.
It's evident as we see people continue to die that we are lacking the services they need, and that's why we need a safe, regulated supply.
That sentiment echoed by drug users on Vancouver's downtown east side, where the community marks another year of this public health crisis.
Disheartening, and it's hard because I walk down the street on a daily basis and I see people hunched over and you can't tell if they're alive or dead.
So Renee, how is the province responding to this?
Well, Asha, BC acknowledges that this serious problem is only getting worse. The government's budget included $1 billion for mental health and addiction, much of which will go to scaling up detox and recovery services. And to help destigmatize drug use, it's also decriminalized the possession of small amounts. But advocates really stress that safe supply issue. Right now, it's available to about 4,000 people. The coroner and provincial health officer want it expanded, but that will need sign-off from Ottawa. Asha?
Renee Filipponi, thank you.
You're welcome.